So I have what they call primary immune deficiency.
We spoke with a San Diego woman who lives with a compromised immune system. She didn't want to use her name, but says her condition has been with her since she was a kid.
I had 2 surgeries before I was 18 for sinus infections that had gotten so bad that they couldn't treat them with antibiotics. I think most of high school I was on preventative antibiotics because I was sick so often.
Something as simple as a cold can send her to the hospital, and like others who are immunocompromised, she doesn't respond well or at all to vaccines. To counter that, she gets monthly antibody infusions to beef up her immune system. When the pandemic hit, the San Diego resident didn't know what to think.
I was terrified. Honestly, I was like, oh gosh, like, because remember the H1N1 was the last pandemic, and I ended up in the hospital during the pandemic, right? Like seriously ill. And I was like, well, I guess I'm going to die.
She got good news in December. A new drug called Evusheld is a preventative antibody therapy proven to give the same protection that healthy people get from COVID-19 vaccines.
I was so excited. I thought, finally, I can maybe like I have nieces and nephews that live across the country, and maybe I can go visit them. And, my parents are older and I haven't seen my dad since the pandemic began. And I would really love to go visit him. Sorry. That one, it's actually hard. I really would love to visit my dad, and I would love to do it and feel safe and feel not scared. Or feel like if I did get it, there was a very good chance I wouldn't get very sick. And I don't have, like I talked about, I just don't have that assurance right now. So it's hard.
She's been medically eligible for Evusheld for months, and even though she needs it, she hasn't been able to get it. Her doctor is in Los Angeles and can't get access. She was excited to hear San Diego County Medical Director Dr. Seema Shah recently putting out the call for treatment requests.
There's definitely increasing demand, but not at the rate at which we would like to see it. And that's really why getting that message out there that if you're immune compromised, talk to your doctor, get your Evusheld.
Wait, it's available?
She tried to get Evusheld locally at UC San Diego Health, but was disappointed to find out that they and other hospitals are reserving doses for their patients. She could become one, but that would mean starting a new care plan with a new doctor. San Diego County officials control the local distribution for Evusheld. The bulk of doses are going to major hospital systems like UCSD Health, Kaiser, and Scripps. Other systems have limited supply.
Healthcare in San Diego is a little bit siloed, and there's the 4 or 5 large systems, but also a lot of people that have private physicians, and they're kind of lost here. And so we're happy to serve that role.
Christian Ramers is Chief of Population Health at Family Health Centers of San Diego. It's one place that takes outside referrals for Evusheld.
We've had people come down from large transplant centers in Los Angeles who, for whatever reason, cannot get it from their own system. And we've even had inquiries from out of state.
The county is working to expand awareness about Evusheld, but the current system doesn't work for everyone.
I actually found a infusion center in Oakland.
The San Diego resident is not waiting around and is jumping on an opportunity to get the treatment up in Northern California. It's not her preferred option, but sees it as the only way to get the same protection that vaccinated people have.
The shot was free for everybody. I feel like we should also make this really easily accessible for everybody that's immune deficient and needs it. So that way they are protected and they have the same equal of a protection as a vaccinated person beside them.
Federal data shows UC San Diego Health has access to the most doses of Evusheld. However, they aren't available to everyone who is immunocompromised. UCSD health officials say that they are working with the county to develop an open referral process, but that system isn't in place yet. Matt Hoffman, KPBS News.